One part of the debate over abortion rights that can be overlooked and shouldn't be is around unexpected costs, financial burden. For example, lawmakers in California are about to vote on a budget that would set aside $20 million to cover some out-of-state abortion travel. Supporters hope to ease some of the economic consequences for those in states where abortion is now essentially illegal. Joining us now to discuss, my dear friend Sheila Kolhatkar. She's a staff writer at The New Yorker, where she covers business and economics. Sheila, it is so good to see you. You were writing about the devastating impact of abortion bans before the Supreme Court rolled back Roe. So help explain to us where we are, because 70% of women who seek abortions live at or below the poverty line. How does this leave them?
Well, so listen, the fact that states, Democrat-leaning states, are setting aside funds to help pay for women from other states to come and get abortions is an acknowledgement of the financial consequences of not having accessible, safe, legal abortion services. And the fact that those consequences can really be devastating. One thing that we know very clearly is that abortion bans hurt the most vulnerable women the most. So low-income women, women of color, rich ladies will always find a way to get what they want and what they need, even if they need to leave the country to get an abortion, for example. But Black women are far more likely to experience unwanted pregnancies. Childbirth is much more dangerous for Black women. And as you mentioned, a huge proportion of abortions are obtained by people living below the federal poverty line. So, you know, one thing that people who are opposed to abortion choice like to ignore is this terrible financial toll. But it's important that we continue to keep attention on it.
So if and what are those states offering? The states that are looking to limit or eliminate abortion access, are they now offering more financial support? I'm thinking about all of those women who might lose their homes, who might lose their jobs, who might potentially lose their education because they're pregnant.
Well, so of course, yeah, it's just not really possible to live in a modern democratic society with a modern economy if you have your entire female population in a situation where they can't control their own family planning. And all you really need to do is look at what happened to women as a whole after abortion became legal. So, you know, it had dramatic effects on the ages at which women became mothers and the circumstances under which they became mothers. It reduced the number of teenage mothers by a third. It reduced the number of teenage marriages by a fifth. And women who were able to delay becoming mothers and do it on their terms when it was right for them were much more likely to go to college, to finish college, to pursue higher degrees. They spent longer time in the labor market. They were much more likely to enter higher paying professions, and they were much less likely to be in poverty in old age, which is huge because, you know, once a woman falls into poverty, she passes that down to her children. It becomes a generational burden. So, of course, yes, it would be logical for some of these states banning access to this service to introduce new services to help make up for this. But that is not happening, which will not surprise you.
California wants to be a safe haven for women across the country who are seeking abortion services. Is this budget proposal going to pass? $20 million. Is that what the people of California want? Many of them could say they live in California. They pay those high taxes because they want the policies that that state passes. Could they not pass this budget and say, we understand it's terrible or we don't support what's happening in other states, but we don't want our tax dollars to go to that?
I could certainly see some Californians making that argument. This is really, this whole idea is based on compassion, really, and there's less of an argument for self-interest for California residents in doing this. However, it is, again, a nod to the fact that this will overall raise costs for everyone. And, you know, one area I've looked at really closely is the health insurance market. Any health insurance company that covers women under its health insurance plans may end up in a situation where, you know, they're going to have to readjust their cost estimates for women because they're going to be having more high-risk pregnancies, more high-risk childbirths. A lot of pregnancies that might have been terminated will now be carried to term. You might end up with more newborns with health issues. All of those things are going to lead to higher costs. And The fact that California wants to take a compassionate step like this is an acknowledgement of that burden that is going to fall onto everyone, unfortunately.
And for many of those women, California is far, far, far away. It could take them hours and hours to get there. Sheila Kolhatkar, it is so good to see you, my friend. Great reporting, really important reporting that people need to pay attention to.